Hi, Mrs. Jones. I'm going to give you an enema today. I filled this bag right here, 500 to 1,000 milliliters. I'm going to place the soap in it, but first I'm going to don clean gloves. I'm going to put the little soapy in there. I'm going to raise the bed. And that water is going to be 105 to 110 degrees. And I'm going to assist her on her left side, and that is because the anatomy of the large intestine, and that the heart is on that side, so it causes it not to work as hard. Okay, on the count of 3, I'm going to roll you over. 1, 2, 3. Okay. Have her do that. Then I'm going to provide her with a bath blanket. Okay. I'm going to place this sheet and I'm going to put it shiny side down. Okay. There's that. Okay. Then I'm going to prime this tube first. I'm going to open it up, allow the water to come in so there's no air left in it. Then I'm going to clamp it back up. Then I'm going to lube this up. And I'm going to place it 3 to 4 inches into the rectum. And then if this was a real scenario, I'd unclamp that to let the fluid start. But before I do that, I'm going to start at that hip level and move up slowly. If the patient complains of abdominal cramping, I'm going to take it off again and I'm going to start at their hip and move up slowly. And if they still continue to have abdominal cramping, I'm just going to stop it completely. Now I'm going to let this fluid drain. Just give it a second. Okay. I'm going to clamp this off. I'm going to pull it out. Then I'd wipe anything that came off with this if it needed it. I'm going to have them sit there for 5 to 15 minutes before I allow them to go to the bathroom. So we're just going to pretend it's been 5 to 15 minutes. I'm going to provide them with a bedpan. I'm going to have them roll over. Okay. Then I would set the head of the bed up so they were comfy. Then I'd let them do their thing. And this can be delegated to a nursing assistant. And I would call the provider. And then I let them use the bathroom. And I would place their call light before I left. And then I'm going to come back here and raise the head of their bed again. And then I would have them turn over so I can wipe the rectum area. And then after I wiped it, I would dump this out, but before I'm going to assess for any abnormal findings. And then I'm going to take this out, throw that away. And then I'm going to allow them to roll back over, apply their blanket again, and lower the head of their bed, or to whatever they like. Put that over there. I'm going to put their side roll back up. I'm going to lower the bed.